Yeah, everyone's stayed around. That was my first one. She was great. She was a big.
Call the meeting to order at 3:05 PM. Andrea, can I have a roll call, please?
Everyone's here, Chair Perezco, Vice President Rodriguez.
Here.
And Secretary Barraza.
We'll move on to, is there a motion to approve the agenda as is?
So moved.
All those in favor?
Aye.
We'll move on to meeting minutes in the September 10th meeting.
I'll move to approve.
Also give, all those in favor?
Aye.
Move on to public comments. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to not more than 3 minutes. The committee cannot take action on items not listed on the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Are there any public comments?
There are no public comments.
Are there any public comments here? No. Okay, we'll move on to the Chief Executive Officer report.
I would like to ask Donna if she would give us an update on the RFP, please.
All right, so it closes tomorrow, the RFP. We've had quite a few people that have been filling it out, but only 6 have submitted so far. We'll see tomorrow if there's gonna be a flurry of,
Last minute.
it's 12:59 PM.
Did you see the emails from Erica? There's a bunch of them starting to.
Starting, yeah.
Like 40 that are filling in now or something like
That's
that.
typical.
Right, yeah.
We look forward to
So we'll
hearing
have more to report.
Chris, can I ask, and stop me if this is not the right place to do it, but there was discussion at the board meeting on the sponsorship stuff.
Mhm.
So is that something we should refer to like the policy committee? to come up
Actually,
with-
that's what we're doing because we've already established a policy. That's why I was
Right.
a little surprised that there was reference that we need to make a policy.
Yeah.
But you know, after the other night's meeting, we want to do some things differently, so we're bringing that to the policies committee next week. With some suggested revisions for that.
And then possibly refer them to the program committee
Yeah,
first.
so that would be the suggestion, is to bring the program committee first, so in that way 3 of the directors are seeing them first, and then we don't have the long, you know, because I see it at this point that it shouldn't be the CEO making the decision on this, because there's too much, and
It just puts you in a really difficult
it
position.
does. And I also think it puts the board in a difficult situation too, but I'd rather it be the board than me.
Yeah.
Plus you guys are the ones, you know, with the fiduciary responsibility too.
But I think, especially like you say, for when we're in the regular board meeting, if we've already, I mean, you bring them to us
Absolutely.
with staff suggestions, we review them, and then
Yeah, it just reminded me of, there was that period of time where we were doing grant applications at the board meeting.
you know,
And that was an eternal board
Yeah.
meeting, and trying to, you get, you know, all directors,
yeah.
you know, kind of vetting the process and that. So I think it's better if we bring it through program committee first. And then, you know, can come with a recommendation
Yeah.
from you as the directors on the program committee. Also in that, you know, we're going to propose that maybe we look at doing this just once or twice a year. Kind of like what the cities do and some other organizations where they have like certain times, because, you know, we're really looking at kind of fall and springtime
Yeah.
is when most of the galas and that fundraisers and et cetera go on.
Yeah, that makes
So,
sense.
so it might be better for us to do that, and that way it's, you know, not coming to like every board meeting and every program committee meeting that we're, you know,
Right.
having to address that. So ultimately, that's up to the board to.
But there would
decide.
still be a flexibility that if there was, say.
There's some one-offs
Yeah.
that we could bring, but we, you know, I think it's appropriate to send the message that, you know, it's not just an open door on it.
Right.
That, you know, that we need need to have some structure with it.
And I think especially, after 2027, when the dollars really start rolling in, I think you're gonna see even a lot more. So if we set that kind of
Yeah,
expectation up front.
yeah. Yeah, I think it's important for us to establish too, some additional guidelines is, like with the food festivals and things like that, if those are important for the, for the board members to
Right.
want to approve those kinds of things, but
Okay,
just want to get some of that language in there.
sounds good.
Okay. Are there any other items you'd like to report on?
No, none for me. Thank you. Sorry.
That's fine. Okay, we'll move on to program updates. Number one is the progress and financial report update. The information is located in the packet. Does anyone have any questions regarding the information provided in the packet?
No questions,
Move on to number two, grant application status report. It was also included in the packet. Does anyone have any questions regarding the status report?
Nope.
Move on to number three, grants payment schedule, and it's currently not available, so we'll wait for that, for the next board meeting. Now we'll move on to grant funding. So number one, grant number 1504 for Regents of the University of California at Riverside, a pathway program to build the capacity of pre-medical students to address the healthcare needs of the Coachella Valley residents for $192,156. I believe the information was provided in the packet. Does anyone have any additional questions that they would like to?
I don't, I just want to thank, Director Barraza on the questions that you asked about Eisenhower and just having the foresight
I
for
wasn't
that.
sure if I was sure, but
Yeah.
the rest of the committee, so.
Yeah, I forwarded so that.
Yeah.
Me too.
And I would just ask if the answers were satisfactory to you, so.
They were to me.
Okay.
Are there any public comments?
Should we communicate those questions here for the
For the public,
transparency of
yeah.
the meeting?
probably.
Did you guys want me to read them? Just kidding. So, there was two questions. I guess one for this particular grant. The questions were, from me to Chris, are there any concerns that UCR Eisenhower Medical Research Associate Program might, which is the grant, the program, this seeking funds? And it continues, might directly or indirectly benefit Eisenhower Medical Center financially. EMC is identified as the lead clinical partner, and I want to ensure there are no conflicts with us funding this program. If I get to read the question, you get to read the answer.
So I answered as such. Eisenhower is not receiving directly and or indirectly any financial benefits. Staff has established protocol that with any grant request that is submitted to the district where Eisenhower is referenced, such as this grant and request from Intercare, the grant application and budget are reviewed and vetted by Jeff Scott. That's our legal counsel. In this grant, UCR had initially added in their request and budget line items funding for Eisenhower staff. These amounts and other ancillary line items were removed. And what had been submitted for program committee review is funding specific for the UCR program and project directors and stipends for the pre-medical student, which would be selected from the Coachella Valley and district residents only. Also, these pre-medical students will be shadowing the Eisenhower emergency room physicians, and I mentioned, please note the pre-medical students cannot treat patients, thus no billing and reimbursements will come into effect. Eisenhower should receive any money that way as well.
Okay. And then,
And Cheney is with us if anybody had any questions for her, but
And is this a new grant or is this one we've done?
it's a new grant.
New one, okay. I'm all for it, but.
And did you want to add anything? I'm sorry,
Well, that's what I was gonna say. I don't have any questions, but if there's anything that you'd like to add. Great. And
Yeah, I'm happy to answer any questions. You all can hear me, correct?
Yes,
Yeah. So if there's any questions, but it is correct that there's no financial support via this grant or request that would go to Eisenhower. But they are our main clinical partner, and that's where we place our pre-medical students.
Okay.
And I did neglect to mention that Eisenhower will be donating the ton of the positions.
Mhm.
How
Exactly.
many was it again? I think I read, but
I'm
Stop.
sorry, can you say that again?
how many residents were there?
No, it's not.
Pre-med,
Or pre-med, I'm sorry.
So this proposal is for there to be 10 pre-medical students in the first cohort. I believe it's cohort 2026, and then there will be 20, so we'll double the cohort. Currently, we have this program. It's in our second year, but we don't have fully a cohort of students from the Coachella Valley, and that's our goal. Mhm.
Thank you.
You're welcome.
People are making a motion?
Oh, I would move, oh, go ahead.
I'll move to approve this grant
Oh,
to the full board.
board. I'll second.
Andrea, can I get a roll call?
Right, so Chair Perezkiel,
Yes.
Vice President Rodriguez.
Yes.
And Secretary Barraza.
Yes.
Okay, grant number 1504 will be forwarded to the board for final review. Move on to number 2, grant number 1518, Riverside Latino Commission on Alcohol and Drug Abuse Services, Inc., Coachella Valley Youth and Family Wellness Initiative. $1,214,466. Information is provided in the packet. Are there any questions or additional comments that would like to be made on this grant?
Any highlights from staff at all or no?
No, it's just, as you know, Coachella Valley Unified School District, they, some major financial cuts, and so this program was cut drastically. And, they originally come to us asking for 4 million,
Oh,
and, we talked, going back and forth and back and forth, it's very interesting, because every school district is different in how they deal with mental health.
mhm.
Palm Springs Unified's got the contract with the RUHS.
Oh, yeah.
Desert Sands is more in-house. They have in-house nurse psychiatrists, and so Coachella Valley Unified School District brings the therapists, and in every school there's a therapist. So this is sort of the gap where some of the therapists would not have been able to be in school, and they've seen an increase in mental health needs for students and their families, especially what's happening in the environment right now, in the administration. So I think this is just for 1 year. They're seeking other funding and they're hoping that Coachella Unified School District will be able to make it up. We go along.
I would just make a couple comments that I'm extremely impressed with the Latino Commission's work, especially in the eastern part of the Coachella Valley. But also the data does show that you have higher rates of suicide and substance use in Coachella Valley Unified School District than you do in the other districts. So with that being said, I would move approval to send this to the board for approval.
Andrea, roll call?
Chair Perezkiel,
Yes.
Vice President Rodriguez.
Yes.
And Secretary Barraza.
and we don't have any public comment.
We do have Saham, who's here, but they wanted to.
Who is here?
May want to say.
Saham, and probably, Leonel.
Saham or Leonette, I'm taking over the meeting.
Is there any additional comments you would like to say?
No, I really appreciate you taking the time to review our proposal and making it, to the next step. We're very excited to be able to support our community.
Thank you. So, that grant will be forwarded to the board for final approval.
Thank you.
Move on to number 3, grant number 1526, Regional Access Project Foundation, Coachella Valley Healthy Living for $200,000 for a 2-year period. The information was located in the packet. Is there any discussion?
We did bring this forward only because of the board approved process on grant applications that are either high priority or not a priority, and that the process is that if it's a non-priority, that the staff would bring it to the program committee to decide whether or not they wanted to move it forward to continue, for staff to continue with their due diligence and do full application. So, we put those different, options in there for you to look at. And, we did have a question on the one, which I messed, I understand where you, did I explain it right?
Yeah, I
Okay.
understood it, yeah.
After I read it, I went, "Oh, I see what she
No, I didn't
yeah,
send it.
okay.
So the question for this grant was, like Donna mentioned, there was 3 options or recommendations. And so I asked, could you please share more context on the reasoning behind staff recommendation number 3? I understand RUHS canceled their grant with 1 year remaining, but from reviewing the application, it doesn't appear the program was intended to conclude after year 2. And then, Donna responded, she said, oh no, because now I want to try to sound like you. You are correct. The county program was not intended to continue after year 2. In reviewing my letter B under option 3, I realized that I wrote it incorrectly. My intent was for the district to pay for 1 year only, the second year that the county was to pay but canceled due to lack of funding, and not fund RAP's request for another year. Technically, this would make the program a 3-year project. Please let me know if you need more clarification. So that was a question. That was her answer.
Thank you. Right, do you have any
No
questions?
questions at all, no.
Okay, so do we have is there a motion to
So,
follow one?
so yeah, I was
One of the
wondering
three?
what would you like to do?
We do have 2 representatives from Regional Access Project here as well.
Is there?
Do we want to read the 3 options so that we
They're
know what
here
you're
also.
considering? Oh, you got them up
I
there, great.
do, yeah, the public is on
Yeah.
So that's 3, should go to 1 and. So I'll read them so that it's on the audio part. So option 1 is the program committee could move this request forward to the board with a recommendation to continue the internal grant process. Option 2, the program committee could deny this request because it doesn't meet the district's high priority strategic goals. Option 3, the staff offers the following suggestions. Item A, since RUHS PH canceled the grant originally for 2 years with 1 year left, the program committee could move this request forward to the board with a recommendation to continue the internal grant process. And B, allow the second year to continue with DHCD funding the remaining year by covering the salaries of 1 full-time program manager and 1 part-time program manager for a total of $66,316.50 and a 15% indirect cost of $9,947 for a total grant award of $76,276 or $263.
I would like to know if the representatives have anything to add or anything that they would to share with the board.
While it's true that.
Introduce yourself.
Sorry, my name is George Holliday. I'm controller for RAF, and been designated to answer questions for this grant and also provide you all with additional information. And I wanted to say that while it's true that there was 1 year left on the RUHS grant with us, the intent of RAP Foundation is to continue this as an ongoing program for us. We feel that this is that it has a significant impact for the valley, and that we want to continue this beyond that period. So we're looking at this being a program. We've already committed, RAP's committed an additional $125,000 to offset what we're losing from RUHS over the next 2 years. And just kind of some real quick statistics for you on this, where we're standing right now with this is this month already, we've already done nutritional training and classes for 64 adults, which includes 48 educators through First Five Riverside and 16 parents at 2 of the Desert Healthcare or Desert High School and elementary schools, or Desert Hot Springs, sorry. And next week, we're supposed to be installing our first of 8 gardens that we're installing in the Coachella Valley Unified School District. Currently with our program, we are covering 8 schools in the Coachella Valley Unified School District and 3 schools in Palm Springs Unified, and also providing training and education for Olive Crest, Mecca Boys and Girls Club, Desert Hot Springs Family Resource Center, and the Mecca Family Resource Center. And currently, through the end of this fiscal year, which actually ended last week for RUHS, there were two other organizations in the Valley, ENAP and UCCE, that were providing services. They are discontinuing their services that they are offering for kids. So that's why we picked up a couple of schools in Palm Springs Unified. But with our staffing right now, we're kind of limited, so we're trying to keep those. But we've also been contacted by Blue Zone Coachella, who's asking that we also provide nutritional classes for seniors. So there's a huge demand for this. And so we really, like I said, we've looked at it, and based on the demand from our side, we feel that this is something we're going to continue. Whether RUHS ever picks this up again or not, we're going to continue at doing Coachella Valley Healthy Living. So we feel it's an important piece for both the kids, their parents, and with the Blue Zones, the seniors as well.
Do you get any funding from First Five?
No, we don't get any funding from First Five.
Have you approached them to ask?
I don't believe we have yet. We've been looking at a lot of different avenues right now. We've reached out to Department of Agriculture. They've got a grant program. We've applied with
Yeah,
them.
look on that, but yes.
Yeah, so First Five is one we have not looked at.
Yeah, I would approach them. My other hat is I work for the county. Especially because you note in here too, with the reduction in SNAP and possible reductions in WIC, that definitely affects, younger individuals. So it's just an opportunity. It's not that I'm opposed for us giving money to you as well, but the
No,
more we get
we're
leverage-
welcome for any suggestions. I was actually at a conference in Sacramento last week. And so we got some good leads from them as well, because there's a lot of people there that are in the same situation we are, because a lot of these are federal funds, and the federal funds have dried up, as everybody knows.
So these are grant funded positions then, right? So once the grant ends, what are you gonna do with those positions?
The grant for RUHS,
The the program directors that you have in the programs?
I mean, when RUHS funds run out?
No,
Oh,
well, because you.
right now,
You're
we're,
running out, but then you're asking the district to pick up the slack of what RUHS canceled, but did you hire those people specifically for this position?
yes,
So
one is
they're grant
actually,
funded positions.
yeah, so Adam's position is funded 50% by REP and 50% by those funds.
Okay.
Ashley is 100% because she's also doing the tobacco awareness, which has not gone away. And they funded, I think, 25%, is that right? Of her, of her position. And then we got one additional person that we produced a part-time because of the funding cuts. Because we, like I said, RAP's gonna pick up from our funding, our own dollars, $125,000 to offset. But we're looking for additional funding to offset the remainder of it, because the Healthy Living runs about $250,000 a year.
I only ask because we at one time under Kathy Greco, we took this position. That's how Alejandro came into.
Oh, wow.
Yeah.
And it was through the NEOP, nutritional.
Oh,
Education,
yeah, yeah,
Obesity
yeah.
Prevention, and then we tied it into our Ready Set Swim. So the kids would do the Ready Set Swim, learn how to swim, and then Vanessa, who was with us, she gave the educational and started with the gardens and everything.
Yeah.
And then that grant ended and we decided not to continue it.
I just add another comment too, is that I realize it's not in like our high priority zone, but again, as we see the changes at the federal level, is that I think we have a role, and it's just my opinion, as a district, especially when it comes to health and well-being, especially of children, to make up for what the uncertainty is in funding around that aspect. So I would move approval to send this. I guess it would be.
Apparently right now, it's direct discussion and direction to move forward with our due
To the
diligence.
Due diligence.
process.
Okay, I'm sorry.
So
So I would make the motion to move forward with your due diligence. So
So there's, two districts that are included, but what happened to Desert Sands Unified School District? Why are they not included?
We have not included them as of yet, mainly due to budget and staffing constraints. So this last year, we've really been setting up, our relationships with the different districts. And, so that's where we are now, and, moving forward, we would love to expand. Yeah, we would love to expand into that as well.
I'm just wondering, because there's 3 school districts, I think all 3 would benefit from the program, you know, and I know that there's a strength, some areas are needed more, but I think equally would be, you know, if they were dispersed equally, it would be better, so that we can.
And there are some constraints because with ENAP and UCC, and a lot of that will be going away in the coming year as they wind down their programs. Is one of the restrictions is they don't want us overlapping with what other basically doing dual work, because one program may be doing the same thing we're doing, and so they kind of had everything kind of parsed out. As they wind down their programs, that's going to go away. And so that is going to open up more need.
So there is somebody else providing this service at Desert Sand.
Only to the end of their contracts. So their contracts, I think technically ended September 30th, but I think they're still spending out some dollars because we did get, the county did notify us that we had an additional 25 they were sending out to us that they had dollars to spend. So we did get that notification from them.
So to Greg's point about the children,
Mhm.
what grades are you serving this program, in 2 school districts?
K through 12, yeah,
K through
we're
12.
doing all ages.
And then would this request include what Blue Zones Coachella wants you to do for seniors, or is that something different?
Yes, it would include that as well.
And has there been any discussion with Blue Zones in Palm Springs about same activities? And if not, just say no, that's fine.
I don't believe so. We're working with them a lot, but more with the tobacco control program.
Okay. Oh, okay.
So, I don't believe that we've had that discussion with the nutrition program.
And I would argue the nutrition program probably is more needed in the eastern part than, say, in Palm Springs, although there are nutritional issues in Palm Springs as well. I'm part of the Blue Zone Steering Committee in Palm Springs, and we're noticing this disconnect between the different, so, you know, Blue Zone staff's trying to figure that out. That's not my problem, but.
That was kind of our concern. So.
Yeah, well, we have 5
And the whole
Blue
Blue Zone
we have 5 Blue
itself.
Zones in the county, and so then there's no
Nobody talks
communication
to them.
with any of them, so, yeah, but that's being discussed with Blue Zone leadership. But it's nice to hear that at least you're doing the tobacco stuff with them, so.
So based on the 3 options that were provided, which one is there a motion?
I've just moved for more due diligence. I would prefer, I think it was the option 3, that we fund the
The remainder. of
the
the program.
remainder of the year, the final year, correct? Push back on.
So I would like actually for them to be funded for the 2 years, just for a little bit more security.
Oh, okay, yeah.
So like that would be my motion, added, which would be 1. We send it to the board, and then they'll either approve it for it to continue.
Yeah, I agree. I agree.
Okay, so the motion is.
And to move it forward to the board.
It's actually just direction.
Oh, sorry,
Stop.
the direction.
It
Oh, that
would
is-
go to the board to decide then moving forward with our internal grant assistance.
so that's the direction. Do you have any questions?
Nope.
Thank you. Thank you. And we'll move on to committee member comments. Are there any committee member comments at this time? Okay, we'll adjourn the meeting at 3:34 PM and we'll move directly into